Injury update, guys. We're going to talk about Jaden Ivey's leg injury. We're going to talk about the recovery process, what exactly happened, and how long he's going to be out for. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist and co-founder of the Basketball Doctors. So we're going to go over Jaden Ivey's injury and break it down of what the potential diagnosis could have been and what the real diagnosis was. So as you can see in the video, it happened on this play, loose ball play. He's going for the rebound. Cole Anthony comes in and almost takes out his leg. But the key thing they would want to see in the video is that his leg is slightly off the ground when he gets taken out, because that changes our entire diagnosis. Because if his foot was down on the ground and Cole Anthony came down on him, there's different things that could happen. One, we're looking at dislocations at the knee or ankle, depending on how much weight he was putting on the ankle or on his leg when this happened. Two, we're also looking at a high ankle sprain because of the twisting motion and him pushing. And three, we're actually looking at different types of fractures besides the one that he was in. So the diagnosis, official diagnosis at the MRI and X-ray were fractured fibula. And we're gonna go over why it was that versus the others, like I mentioned. So for the first one would be more the dislocation. As I mentioned, you would get more of the dislocation at the ankle or knee if your foot's planted and then they hit you. Because his foot was slightly coming off the ground, that changes the whole moment arm. You're not putting weight through your leg, so you're not have that stable force down and then someone hitting you. Because your leg's slightly elevated, when someone hits you, your whole body will go with it. As opposed to if your foot's planted, someone hits you, you might not go, but your leg might go. And that's where we have those dislocations. And when we have those dislocations, not only do we injure the ligaments, but we also injure the arteries potentially and also nerves. So that's why sometimes people have those worst case scenarios where they might lose their leg when they dislocate, like the NFL player Alex Smith, these crazy injuries, because when you dislocate, you move the joint and there's nerves and arteries that go through there besides just the ligaments. So that was the worst case scenario. That got cleared out of the way, but it's always kind of worrisome when you get taken out in a stretcher with a vacuum sealed. But that's why it wasn't a dislocation versus a fractured fibula. The next one, we're looking at a high ankle sprain. So a high ankle sprain actually would have taken longer than a fractured fibula as well, even though it sounds not as bad, but a high ankle sprain takes longer than a normal lateral ankle sprain. The reason why is because it's the sprain of the ligament between the two big bones, the tibia and the fibula, and that ligament helps stabilize that, and it prevents any excessive motion between those two bones. And what we also see is that whenever that happens, it affects those basketball players cutting, changing direction. But normally this injury happens when your foot's also planted on the ground and you have a twisting motion. So it would have hit him, you would have twisted, and he twists those two bones there. But because his foot was slightly elevated, that changes the whole equation of the weight bearing, and that leads to more of that fibula fracture. And possibility number three that we also thought was just a different type of fracture. So we were talking about potentially a tibia fracture because of the force, but with that one, usually you want to have your leg planted as well. And also the fracture could have been an open wound where they hit him so much the bone kind of sticks out. It's an open fracture. Think about like Paul George, or I think his name was Kevin Ware from Louisville back in college. So that's when the fracture actually is, you break it and it actually sticks out and pierces through the skin, and then we have to rule out infection and all the other things that go in with it. But those are all the differential diagnoses, but the official one was the fractured fibula, and it makes sense because his foot was slightly elevated and they hit him right on the side, and that's the bone on the outside portion of your leg. All right, guys, so the diagnosis recap. So it's a fractured fibula, which is the bone in the outside portion of your leg. Remember, there's two bones, the tibia, fibula, and because it's a non-weight bearing bone, the healing process is a little bit easier than the other ones. So the fibula bone itself is going to heal around 6 to 8 weeks. That's how the normal bone tissue healing properties are. Because he's young, we're thinking more than 7 weeks. As you get older, it takes a little bit longer. Because it's still not fully weight-bearing bone, he's still not going to be able to put too much weight on his leg. So look for this time between those 6 to 7 weeks of him doing non-weight-bearing exercises. He's probably going to be using blood flow restriction training to really maintain his muscle. Check out the links below. We have great videos on what exactly blood flow restriction training is. But just doing a lot of stuff that are just non-weight bearing. That way, after he gets cleared of the bone healing, he can start loading it back again. So getting his strength back and slowly tolerating more and more load of him, getting back into jumping, running, sprinting. So after the 6 to 8 weeks, of the bone healing. It's gonna take him another 6 to 8 weeks for him to ramp up, get stronger. And then after that, we're expecting around 3 months, but we also want to look at how his confidence is, how his mental approach is, because whenever you fracture bone like that, it takes a while to really mentally prepare to go back into basketball, especially because it is a contact sport and that's how it happened. But we're thinking around that 3-month mark. So we're looking at that March, April for him to be back. That's kind of what we think, but there's other things, if there's any hiccups in the process, but that's kind of a rough estimate. But if you guys have any questions regarding his injury, or if you guys want us to do any other breakdowns of different injuries like that, especially with the rehab, comment below. We are the basketball doctors. Let's ball for life.